Metastatic brain tumors are a big class of brain tumors, and in fact, they're the most common brain tumors that you'll see. Metastatic brain tumors come from cancers elsewhere in your body. So, for instance, lung cancer or breast cancer or colon cancer. Metastatic brain cancers can either go to the brain matter itself, or they can also go around into the covering of the brain. And it in part depends on the kind of cancer you have. In any case, the symptoms really depend on where they end up. So if you end up in an area that affects your vision, then you could go blind in part of the visual field that you're looking at. If the brain metastasis goes to a sensory area, then you could, for instance, feel like you have a ghost arm or something like that. Again, it just specifically depends on where it is. Now, if you have a really large brain metastasis, that can globally increase the pressure in your head, and that can lead to things like morning headaches, nausea and vomiting, and blurred vision. Traditionally, brain metastases were dealt with separate from the body disease because of something called the blood-brain barrier. The blood-brain barrier prevents most drugs from entering the brain. And so what you would traditionally have is a radiation oncologist and a neurosurgeon working together to provide surgical management and radiation oncology management of your brain metastases. But things are changing. So for instance, at Siteman Cancer Center, we have a multidisciplinary team. And so it's not just surgeons and radiation oncologists, but we also have a medical oncologist on our team, and we together think about how to treat the brain metastases. In terms of the surgical management of brain metastases, that's still required sometimes, but we have more than one approach now. We not only do different open surgeries, and sometimes through very small craniotomies, small bone flaps to take out large tumors, but we're using more minimally invasive techniques. And a key one that we have leadership in the country on is laser interstitial thermal therapy, or laser therapy. And so using a laser probe through a small hole in the skull, we can basically go to the middle of the brain metastasis and kill it with heat from the inside out. Typically, patients are leaving the next day, for instance, and getting to work much faster after laser therapy. An advantage of coming to Siteman Cancer Center is that we're used to thinking of the most complex patients. So patients that have undergone multiple rounds of radiosurgery or surgery, and a lot of these people are losing hope. We've seen a lot of these individuals, and we're able to offer additional therapies based on our research. What we're doing here in collaboration with centers elsewhere is that we're doing laser thermal therapy, so that, again, heating the tumor from the inside out through a small hole, along with things like radiosurgery. It turns out if you put the two together, that you decrease the risks of radiosurgery while killing the tumor and having more effective control of the brain metastasis. If you come to Siteman for your care, you'll see a multidisciplinary team, and that begins with the multidisciplinary tumor board. At the tumor board, we will discuss your case in front of many experts. I'm not talking one or two or three, but 30. And that includes people like medical oncology, neurosurgery, radiation oncology, neuroradiology, and even endocrinology. And we'll, all of us together, discuss your case and arrive at a consensus opinion, a consensus recommendation for your care. I think this is really important because, we don't have any biases then. We are open-minded and we listen to everyone's opinion, and we come up with the best plan for you.